This is Johnny, and Johnny is far from happy. For over 3 months now, Johnny has been sleeping poorly. He has a very annoying stuffy and runny nose, he's unable to smell his favorite foods, and he experiences severe headaches and a sensation of pressure on his face. In short, these are the classic symptoms of an inflammation of the nasal mucosa and paranasal sinuses. Johnny is accustomed to it. He always thought the inflammation was caused by his usual seasonal allergy, but after more than 12 weeks of symptoms, he got tired of suffering and decided to visit an allergist. The allergist listens carefully to Johnny, conducts a thorough examination, performs further tests, and finally communicates the diagnosis. Johnny suffers from chronic rhinosinusitis, also known as CRS, a disease that can affect people of any age and sex, though it often occurs in men over 40. The allergist then informs Johnny that he might also suffer from nasal polyps. Johnny is a little frightened. He doesn't want to feel so ill anymore, and certainly doesn't want mollusks inhabiting his nose. But the doctor reassures him and begins to calmly explain everything he needs to know about his condition and the therapies that can help. The first step to find out if Johnny actually suffers from nasal polyps is to visit an otolaryngologist who performs a nasal endoscopy, a completely painless examination where the inside of a patient's nasal cavities is observed with the aid of a small camera attached to a small tube. The otolaryngologist discovers that many of Johnny's sufferings were largely caused by the presence of benign growths along his nasal mucosa and inside the paranasal sinuses called polyps. Johnny will also undergo a nasal cytology to determine the degree of inflammation in his nose and the best therapeutic treatment for his condition. This inflammation and subsequent polyps are triggered by the activity of immunoglobulin E, or IgE, and eosinophils, actors of the immune system, whose task is to rid the body of allergens and parasites. However, when there are too many IgE and eosinophils in the body, inflammation is triggered, resulting in allergic reactions. Especially in individuals with nasal polyps, a strong presence of mast cells can be observed. They are immune cells that originate in the bone marrow and are then present in all tissues. These cells activate and increase the inflammation caused by IgE and eosinophils and the risk of nasal polyps. At this point, Johnny wants to know if there is a cure, a way to make him breathe freely again. The doctor replies that yes, there are various treatments, both medical and surgical. Medical treatments, such as nasal washes with saline solutions and the use of nasal sprays with powerful anti-inflammatory agents like cortisone, aim to reduce inflammation and the likelihood of its relapse. Surgical option involves removing polyps that fill the mucosa and block air passage. This surgical procedure, performed endoscopically, is almost entirely painless because nasal polyps lack nerve endings and can provide significant symptom relief to the patient. The only downside is that sometimes, if preventive care is not followed post-surgery, polyps can recur, and some patients are more at risk than others of experiencing what is called a relapse. In this sense, the multidisciplinary work between the otolaryngologist and the allergo-immunologist is very important, as together they can predict with reasonable certainty the risk of relapse. Finally, for the most severe patients, particularly those with nasal polyps, approaches with biological drugs called monoclonal antibodies that directly block the immunological mechanisms underlying the inflammatory process have shown extreme efficacy in reducing the extent of chronic rhinosinusitis, nasal polyps, their symptoms, and in improving the quality of life of patients. Johnny is now more at ease because he has received all the necessary information. He knows that chronic rhinosinusitis and nasal polyps are debilitating diseases that drastically reduce the quality of life. But he also knows that there are very effective treatments available and can finally look forward to the future and to next spring with a smile.